You should clean your wounds with rubbing alcohol. Using rubbing alcohol to clean wounds is a common myth, but it's not recommended due to the severe pain it causes. Alcohol can damage tissues and delay the healing process by drying out the wound. Instead, simple soap and water, or an antibacterial soap, should be used to clean the wound effectively. Cleaning with these methods is less painful and helps remove dirt and debris without damaging tissues. Keeping the wound moist, rather than dry, aids in better and faster healing. Applying a Band-Aid or other sterile dressing can protect the wound from infection and further injury. Using triple antibiotic ointment can also help in the healing process by preventing bacterial infections. Always avoid using harsh substances like alcohol or hydrogen peroxide on open wounds. Slap a choking person on the back. Slapping an adult who is choking on the back is not recommended and can make the situation worse by causing the object to lodge further down the throat. Encouraging the person to continue coughing is the first step, as coughing is the body's natural way to clear the airway. If the airway becomes completely obstructed, performing the Heimlich maneuver, abdominal thrusts, is necessary to dislodge the object. Properly performed abdominal thrusts can save a life without causing additional harm. It's important to follow protocols like those from the American Heart Association, which emphasize the Heimlich maneuver for choking victims. Always call 911 if the situation doesn't resolve quickly to ensure professional help is on the way. In the case of infants and young children, back blows and chest thrusts are recommended instead of abdominal thrusts. Knowing the correct procedures for different age groups can make a critical difference in an emergency. After getting stabbed, take out the sharp object from the body. Removing a sharp object from a stab wound can cause more damage to the surrounding tissues and lead to severe bleeding. The object may be tamponating, plugging the wound, and preventing excessive blood loss. Stabilizing the object in place and preventing further movement is crucial until medical help arrives. This approach minimizes additional internal injuries that can occur from the object's movement. In movies, removing the object may add drama, but in reality it's extremely dangerous. Always leave the object in place and seek immediate medical help to ensure proper care. Medical professionals can remove the object in a controlled environment where they can immediately manage bleeding and other complications. Stabilizing the object also helps paramedics during transportation to avoid further damage. If someone gets a concussion, keep them awake. It is not necessary to keep someone awake after a concussion, contrary to popular belief. This myth stems from the mistaken idea that sleeping can cause a coma or brain damage, but there is no evidence to support this. The priority should be to monitor the person for symptoms of a worsening condition, such as slurred speech, vomiting, or unsteady gait. If any of these symptoms are present, seeking medical attention is essential. Letting the person rest can actually be beneficial as it allows the brain to recover. Proper medical evaluation, including a CAT scan if necessary, can rule out severe complications like bleeding in the brain. Rest and avoiding physical or mental exertion are often recommended during recovery from a concussion. Follow the guidance of healthcare professionals for the best outcome. You should put something into the mouth of someone having a seizure. Placing an object in the mouth of someone having a seizure is dangerous and can cause injuries such as broken teeth or jaw damage. The concern about swallowing the tongue is a myth. It's physically impossible for the tongue to block the airway completely. The focus should be on preventing injury by moving harmful objects away from the person having the seizure. Once the seizure subsides, gently rolling the person onto their side can help keep the airway clear. Avoid putting anything in the mouth to prevent further injuries. If the seizure lasts longer than 5 minutes or occurs in clusters, it requires immediate medical attention. Continuous monitoring and ensuring the person is in a safe environment are crucial. Seeking medical advice after a first-time seizure is also important for proper diagnosis and management. Always suck the venom out of a snakebite. Sucking venom from a snakebite is ineffective and can cause additional harm, such as introducing infection into the wound. Venom spreads quickly through the bloodstream and cannot be removed by sucking. Applying a tourniquet can cut off blood flow and cause more damage to the limb. The best course of action is to keep the person calm and still to slow the spread of venom. Calling 911 immediately and getting the person to a medical facility equipped with antivenoms is crucial. Avoid applying ice or attempting to cut the wound. Keeping the bitten area at or below the level of the heart can help slow venom spread. Follow the instructions of emergency medical personnel for the best outcome. CPR requires mouth-to-mouth. Modern CPR guidelines emphasize hands-only CPR, focusing on chest compressions to maintain blood circulation. Mouth-to-mouth resuscitation is no longer required due to the risk of disease transmission and the simplicity of chest compressions. Chest compressions keep blood circulating to vital organs, particularly the brain and heart. Performing compressions at a rate of 100 to 120 beats per minute is essential for effectiveness. Immediate and consistent compressions increase the chances of survival in cardiac arrest situations. In some cases, such as with drowning victims. Rescue breaths may still be recommended, but for most adults, hands-only CPR is sufficient. Learning hands-only CPR is accessible and can be a life-saving skill. Always call 911 and follow dispatcher instructions while performing CPR. You have to be medically trained to use a defibrillator. Automated external defibrillator, AEDs, are designed for use by the general public and do not require medical training. AEDs provide clear, step-by-step voice instructions to guide the user through the process. These devices can analyze the heart's rhythm and determine if a shock is necessary. Using an AED as soon as possible increases the chances of survival for someone in cardiac arrest. Public access to AEDs in places like airports, malls, and schools makes it easier to respond quickly in emergencies. Don't hesitate to use an AED if someone is unresponsive and you suspect cardiac arrest. Immediate action with an AED and CPR can significantly improve outcomes. Following the AED's prompts ensures that you are providing the best possible care until professional help arrives. Put butter on a burn to heal it. Applying butter to a burn is an old wives' tale and can actually worsen the injury by trapping heat. Cooling the burn with cool, not cold water for at least 10 minutes is the proper first aid step. Butter can also introduce bacteria to the burn, increasing the risk of infection. Keeping the burn clean and covering it with a sterile, non-stick dressing helps protect the area. Over-the-counter burn ointments and pain relievers can aid in comfort and healing. For more severe burns, seeking medical attention is necessary to prevent complications. Avoid using ice, as it can damage the skin and tissue. Following proper burn care procedures promotes faster and safer healing. If you get frostbite on your hands, rub them together to warm them up. Rubbing frostbitten skin can cause further tissue damage due to friction. Gradual warming in a warm environment, such as placing the affected area in warm, not hot water, is safer. Removing wet clothing and avoiding direct heat sources like fires or heaters is essential to prevent burns. Frostbite can lead to severe and irreversible damage if not treated properly. Medical evaluation is necessary for significant frostbite cases to assess the extent of tissue damage. Avoid using direct heat sources, as they can cause burns on numb, frostbitten skin. Properly rewarming the affected areas and seeking medical attention ensures the best chance of recovery. Follow-up care may include medications and therapies to promote healing and prevent complications. Cardiac arrest and a heart attack are the same thing. Cardiac arrest and heart attack are distinct medical conditions with different causes and treatments. Cardiac arrest occurs when the heart suddenly stops beating, requiring immediate CPR and defibrillation to restore heart function. A heart attack, or myocardial infarction, happens when blood flow to a part of the heart is blocked, causing chest pain, but not necessarily stopping the heart. Recognizing the difference is crucial for providing the right first aid. For cardiac arrest, immediate action with CPR and an AED is vital to survival. In the case of a heart attack, keeping the person calm and calling 911 is essential while waiting for professional help. Administering aspirin, if the person is not allergic, can help reduce heart damage during a heart attack. Both conditions require urgent medical attention, but they are treated differently based on the underlying cause. If you witness a drug overdose, put the person in the shower or bath. Placing an overdose victim in a shower or bath can be dangerous and ineffective in reversing the overdose. Temperature extremes can disrupt the body's homeostasis and worsen the situation. The priority is to call 911 immediately for professional medical help. Administering naloxone, Narcan, if available, can temporarily reverse the effects of an opioid overdose. Keeping the person awake and monitoring their breathing is crucial until help arrives. Moving the person to a safe position, such as the recovery position, helps maintain their airway. Continuous observation is necessary to ensure they do not choke or stop breathing. Providing accurate information to emergency responders about the substances involved can aid in their treatment. While it's crucial to debunk common first aid myths to ensure physical well-being, it's equally important to address misconceptions surrounding mental health. Just as incorrect first aid practices can harm, so too can mental health myths prevent people from seeking the help they need. To promote a better understanding and support for mental well-being, join us in our next video where we'll explore and debunk some prevalent mental health myths. Watch the next video to continue your journey towards comprehensive health knowledge and to learn how to better support yourself and others in mental health matters.